6, and we have 7 who have signed up. The board may limit the total time for comments or may reduce the time allotted for each speaker. All comments should address a matter related to the Shenandoah County Public Schools. Complaints regarding division employees should be directed to the school principal or an appropriate school division official. The school board expects that each speaker will be courteous, modeling for our students how one can respectfully disagree with others' views. Speakers will address their comments to the entire school board and not to one individual board member, to the superintendent, to a staff member, nor to the audience. Speakers will not engage in personal attacks. Speakers may sign up to speak at the school board meeting, which they have done. On a document provided by the clerk of the school board clerk will ascertain that speakers indicate their role as stakeholders in valid addresses. Speakers are called in the order in which you have signed up. If time allows, the chair may allow comments from individuals who have not signed up. A speaker may not speak for more than on one specific topic. Speakers who wish to speak on more than one topic must submit a separate request for each item. If a speaker would like to present written comments to the school board, a copy should be provided to the school board clerk as the speaker approaches the podium to speak. Megan, you're up. Megan Winham. And the microphone is there on the corner.
I'm here on behalf of the Shenandoah Educational Association. I'm president, and we have our other board members sitting over there, and so we represent roughly around 126 Shenandoah County employees. But I'm also speaking as a county resident and also a parent. Both my boys attend W.W. Robinson Elementary in the 3rd and 5th grade. So I look at this budget, and in meeting with Dr. Shepard monthly, I know that none of these things are egregious. These are not luxury wish list items. These are things that are there for daily operations of sustainability, and that long-term means that when my boys graduate in 10 years, I will be here in 10 years. So your tenure may be 4 years, 6 years, but the decisions you make on this budget will likely affect long-term me, who will be retiring at Shenandoah County, and the likelihood of my boys graduating in 10 years with a central diploma. So I ask you to look at those items, and logistically we know that you could say yes to every one of them, and we also have to pass yet another hoop with the Board of Supervisors. So yes, I just ask you to look and put your faith in Dr. Shepard as we do, and know that she's not asking for anything out of the ordinary. So thank you.
Thank you. Ben King.
Hello, my name is Ben King, and both my daughters attend Sandy Hook Elementary School, and I live outside of Strasburg. So my apologies if I'm a week late or maybe a week early, I'm not sure. I wanted to speak about the capital improvements that are being considered by the county. I've seen overcrowding the whole time my kids have been at school. However, the plan to take the county park and make that an elementary school, it is the only county park that we have. What I did was I did look at the property that the county owns already. Sandy Hook sits on 50 acres that is only 50% used by buildings. W.W. Robinson sits on 38 acres, approximately a third of it is a building. And there's an adjacent piece of property that's 40 acres that is owned by Shenandoah County. I don't know what that means exactly. So I think the county made a very smart move in the late 70s when they consolidated into 3 campuses. And when we think about the budget long term, having those consolidated campuses allows us to spend money in other places, which you're considering on the budget right now. If we create a new campus with only an elementary school, we're going to increase costs due to busing, as well as increase costs due to an administrative staff that will be duplicated considering it'll be at 3 other campuses. What I'd like you to consider is creating, especially at the elementary school level, a lower elementary school that is attached to the current elementary school. So you have a lower and upper elementary school that can be led by one principal, and then an administrative staff of assistant principals for the 2 lower and upper elementary schools. It will save a lot of money to keep those campuses where they are and not expand again to the middle of the county. Again, only public park in the county. We're thinking about taking that for a school. And I understand why, because of the cost, but if we have open land that we're not using, I think we should utilize that property. It also would allow you, if you did that, to construct a partial building that you could then move students into while you renovate the rest of the building. So it could solve the problem of where do we put the kids while we're renovating the building. And I just want to share that idea with you so that maybe you could direct your architects to consider that idea to preserve the campuses that we currently have. Thank you very much.
Thank you. Ann Weinking. You're not going to use that, are you?
I might. I just, this is a shovel that I took to a park last May, and these are all parent signatures, so I'm bringing some parents with me tonight who are in agreement with what I have to say. Good evening, board members and Dr. Shepard. In 17 days, you will be making a critical decision that will impact almost half the students attending Shenandoah County Public Schools. The Board of Supervisors has communicated to you, tell us what you need. We need a new elementary school, I'm sorry to say this, located between the 320 approved housing projects in Strasburg and the 873 approved housing projects that are in Woodstock that are expected to increase our county elementary schools by approximately 540 students. Those numbers alone would fill a new school with a capacity of 900 students at 60%. This project cannot be delayed another month, let alone another year. Last year at Sandy Hook, when the new front entrance was being constructed, the crew came in early in the school year, tore down the front entrance to the building, and didn't return for over 3 months. And when they did return, the generator they used created toxic fumes that leaked into the first grade classrooms to the point that students had to be removed and relocated. Then, when the project was complete, the primary window access to speak to the main office manager was not installed, and it was rumored to not have been included in the original plans. And there was no ventilation or AC system for that enclosed area, which was primarily glass. It was extremely hot. And those 2 issues had to be corrected at a later date and took a full school year to accomplish. And then this summer at Sandy Hook, the expectation was that the 50-year-old carpet would be replaced with vinyl tiles, and the new trailers would be purchased and installed by October. But here's what actually happened. Over the summer break, only 4 classrooms had the carpet removed, and then 4 more over winter break, and the 5 portable trailers that just recently arrived over a month ago are still unavailable for use and need plumbing for bathrooms and running water. This alone should be enough of an example as to why you cannot properly or effectively do renovations or improvements while students and staff are in session. The fiscally responsible approach to the issues being presented in the proposed budget would to be build a new elementary school first and then prioritize the urgent structural needs of our other school buildings. A plan that demonstrates fiscal intelligence and not another track of mismanagement of school funds. Presenting the Board of Supervisors with a more bang for your buck approach will show them and the taxpayers that the money will not be wasted, but utilized in a way that supports academic success of current students and the generations to come. I know I'm almost done, so I'm going to skip.
You have 1 second.
You asked about the shovel, so, okay. So building and labor costs will only continue to rise. There are more pros than cons to build a new school in Maurytown. I get that none of you sitting here tonight created these problems, but you do have the power and hopefully the vision to rectify it. And then in the words of LV, it's time to go big or go home. Thank you.
Lisa Rogers.
board. Good evening, Dr. Shepard. My name is Lisa Rogers. I am a teacher in Shenandoah County Public Schools. I am also part of the board of SCEA. I'm short and sweet tonight. Basically, I just wanted to say I also support all of Dr. Shepard's plans in the plan for the budget. A couple things I would want to think about is there is the plan in there for the stipends for the special education, but I also hope that in the future we can also think about our paraprofessionals. They are very hardworking individuals in our school, and they do not get the help that sometimes I think they deserve for as hard as we work them. So I hope that in the future we can also consider them in part of our plan. And I also hope you also think about the fact that she is thinking about for us with the healthcare rising costs and trying to level that out. So thinking those together. So those are the two highlights for tonight. So have a good evening.
Thank you. Jessica Seibel.
Hello, school board members and Dr. Shepard. My name is Jessica Seibel. I teach second grade at Sandy Hook Elementary School. My hope and vision for teachers and students in our county is that we will finally see a light at the end of the tunnel. The effects of overcrowding and ignored maintenance have simply become part of our everyday. Having the knowledge that ground will soon be broken and that there will someday be a new building in our county, it would give teachers relief because it would mean that the current conditions would someday improve. All of the issues have been presented already. We all know what they are. Noisy hallways, dangerous traffic conditions, especially at the northern campus, extended lunch times, special education teachers sharing classrooms and having to teach in the hallway. The list goes on, and these problems are not unique to Sandy Hook. We know that a change has to be made. I attended the previous board meeting and had the opportunity to watch the options presented by the architects. As a teacher, you start to develop somewhat of an ability to see into the future. Looking at the plans for extensions to our current schools gave me visions of missed instructional time from walking from one end of the hallway to another, as well as even earlier lunch times to accommodate and increased traffic and noise in the hallway. I can just see it. Our current schools do require our attention. However, we have to start developing a new school first to get the ball rolling. As the architects explained, this is the more cost-effective option with the least amount of interruptions to instructional time. Construction can happen without the displacement of classrooms. When the new elementary school is built, then we can have students from the north end of Woodstock and the south end of Strasburg enroll in the new school in Marytown. This has to be the first step because it's the project that will take the longest. Developments in the area are not going to slow down in construction. So whether we are ready for them or not, the population is growing. So let's be the ones to invest in the future of our students and provide them with the best learning environment possible. Thank you.
Thank you. Kara Morozic.
Good evening, members of the board. My name's Kara Morozic. I come to you as a parent of a first grader, a third grader, and in a year and a half from now, we'll have a rising kindergartner. So all of us here have reviewed this capital improvement plan. We see these 75 projects and we see the critical needs and we also see the costs. But the job tonight isn't just to review that list. The job is to lead. And leadership demands that we stop rearranging the decks on the chair, or the deck chairs on the Titanic. For years, we have been patching, repairing, and keeping this nearly 50-year-old elementary schools afloat. But this presentation and the slides prepared by the administration are clear. With facilities like Sandy Hook at 96% capacity, we're no longer just patching a ship. We are taking on water. The condition of the elementary schools also sends a powerful message to our children. It tells them that how much we value their education, and by extension, how much we value them and their futures. So let's be crystal clear about what taking on water means for the students that we serve. It means that a first grader who is learning to read in a classroom that is so crowded, they can't get the individual attention that they need. It means that the special education students who are crowded into one classroom nearly have conditions that are impossible to work. And it means that teachers and students testing in hallways get more anxiety, and it leads to poor test results, which we have seen this year. The outcomes are sending a clear message that the students' needs are coming in second. The construction of the new elementary school in this plan is listed as an urgent need, and this label is just not enough. An urgent problem demands an urgent response, and that response must be driven by you all in this room. This $41 million project is not an expense to be debated and deferred. It is a moral and fiscal imperative that the board must take a stand and champion. Making the school our top priority is really the only fiscally responsible path forward. It is the strategic move that breaks the cycle, this expensive cycle of reactive maintenance. Pushing for this new construction and how it will be how you create the breathing room to finally address this other long neglected critical infrastructure that are needed and that can allow for planning in a cost-effective manner. But this will not happen on its own. And so it requires you, the board members, to do more than just vote yes. It requires this board to become the vocal, unwavering advocate for this investment. It is the collective responsibility to push for this funding at every opportunity. You must make it clear to the county, the taxpayers, and ourselves that deferring these repairs is losing educational opportunities and is causing a failing our children. So please, do the right thing and build a new school. Thank you.
Thank you. Anna Bartley?
Good evening, members of the school board, Dr. Shepard, everyone else around the table, and everyone who's here tonight. My name is Anna Bartley, and I am a teacher at W.W. Robinson, as well as a parent. I have 2 students in the central campus here, and I'm here to talk about some of the needs that concern me, just both as a teacher and a parent. This is my 20th year with W.W. Robinson, and in that time that I've been here, I've seen just little repairs here and there. I've seen overcrowding. I went from having my own classroom to sharing with 2 others. I'm a specialist, so I'm working with some of our most at-risk students, and I share a room with 2 others. So we have 18 kids in there at one time, and these are kids that we're supposed to be, I work with English learners, so we are trying to devote our time and attention to them, and in that type of setting, there are many distractions. It's not giving the small group instruction that they are supposed to be having by the demands of our program. So that's one thing to consider. And just statistically, it's really hard when you're in a county that is growing, the population continues to go up, and you see our surrounding counties. Since I started in 2006, Harrisonburg City has built 5 schools. 5. They've built 2 elementary schools, a middle school, and a high school, and an early childhood learning center. Rockingham County built another elementary school as well in that time, and the new John Kerr opened in Winchester. So all these surrounding counties are doing all this investing in the future of their students by providing them those learning facilities they need to be successful. We have all the construction and developments that is happening, and we know the projected numbers. We're looking at adding 400 students to the central campus. And I know on paper it says that our building isn't at capacity, but we are busting at the seams and having to share rooms. All the special ed teachers share rooms, all the reading specialists share rooms. That's the biggest concern I have. So when we're moving forward, I think that the expansion into the very limited green space that we already have and maybe taking some of our playground space away, I don't think that's the solution for what our kids need anymore. I think we need to just move forward, and I know we're looking at huge numbers here in terms of expenses, but I don't think that if we look long term, I think that's what we need to do. And so I ask you to please think about and consider the future of our students and our growing community and how much they deserve to have those facilities and resources that they need and not be overcrowded in classrooms of like 26 and 27. And the other concern is the infrastructure, because if we're gonna expand into our campus, like where do the cars go? Where's the parking? Like that's a very nerve-wracking thing to think if we ever had a true emergency, how would we handle that? So please just consider, I'm out of time, I see that. I'm a little nervous, I've never spoken before. But please consider that we need to make those advances and take that step for our students. Thank you.
Thank you. Did anyone walk in late and wish to sign up to speak? Yes?
Sorry, thank you. Lucinda Urbach. Hi, everybody.
Downtown Fishers Hill? Or?
Yes, sir. Well, no, I'm in Strasburg. Daddy's in Fishers Hill. I'll fill that out. Okay, so we can get going. Hi, I'm Lucinda Urbach, librarian at W.W. Robinson Elementary School. Thank you all for your patience with my voice. I wanted to bring another perspective. I don't think the public, this is more for the public because I know you guys are very aware. On the side of art, music, library at our elementary schools. We know that W.W. Robinson used to have 2 librarians, almost 2 full-time music teachers, almost 2 full-time art teachers prior to the 2008 housing market debacle. And there was a lot of belt tightening, and one of the things that happened then was losing one of the librarians, the extra art and music, and I don't mean extra, necessary. And we saw a glimpse of hope that maybe we would return to numbers that were more rational prior to the pandemic. And the pandemic happened. And this goes to what some of my colleagues were saying. We're constantly trying to patch holes, put Band-Aids on, whatever you want to say, duct tape it, whatever. We're just trying to survive. We need to stop doing that. Our children are at a disservice. Every other county, at W.W. Robinson, our students get art an average of twice a month. Music, just twice a month. That's it. All the other surrounding counties and cities, the kids get it every week. And this is because of lack of space, lack of funding. Side note, the additions added in the plan to W.W. Robinson do not add room for another music teacher, another art teacher. So you're going to be adding even more kids onto the campus, into the school, and spreading the art and music programs even thinner than they already are. And this is not fair to our kids. They deserve it more than anything to be able to have those programs. Thank you. Building the school.
This concludes our public hearing according to the call. Sir.
Chairman, I'd like to ask if I could ask the staff and the audience just one question for a hand raise so we can get an idea. I think it would help perspective for our constituents. If I could ask one question. Anybody object?
Okay with me.
I hear no objection.
Our constituents are always reaching out to us, and of course, the number one thing we hear are y'all are raising our taxes. You're gonna cause our taxes to go up. The staff members that are here, if you live in Shenandoah County and you proposed for the new elementary school tonight, you could all raise your hands. I'd like to see how many live in Shenandoah County. So quite a few. Okay, thank you.
Your staff, or you're asking for the people who just...
Staff, because the reason I asked for just staff, I apologize, is because you guys are proposing, number one, you work here and you live here, and you realize our taxes are gonna go up if we do what's necessary. So you realize, I mean...
My step's gonna go to my tax, my step's gonna go to my mortgage payment.
Exactly.
But my kids are in that school, and I approve of that. It's like, I know as all of our parents here, you've all been in this situation where you might have not drank your water because your child's thirsty. You might have not eaten your full plate of food because your child's hungry. I'm willing to give up that money I'm willing to pay more on my mortgage, and I didn't even call to reassess. Like I said, if that's what you think it is, that's what you think it is. I know it's gonna go up, and I know that raise, that cost of living is gonna go right back in my mortgage. And I'm okay with that.
Thank you for that. Thank you all. Thank you all for being here tonight.
This concludes our public hearing according to the call of the meeting. We will reconvene at 7 with the other business, but before we do that, we must properly adjourn this meeting if there is a motion to that effect.
I motion to adjourn the public hearing on the budget.
Thank you, Mr. Thank you. Is there a second to the motion?
Second.
And there are several seconds. All in favor of adjourning until 7 o'clock, please indicate by saying aye. Aye. Opposed, no. And we'll be back in business in 5 minutes. Shenandoah County School Board meeting, February the 23rd, 2026.
Say, start banging.
Madam Clerk, I note the absence of Mr. Street, as previously noted. Is there a motion to approve the agenda as presented?
Move to approve the agenda as
Mr.
presented.
Rickard makes the said motion. Is there a second?
Second.
Thank you, Mr. Shiving. All in favor of approving the agenda as presented will indicate by saying aye.
Aye.
Opposed, no. And the agenda is approved as presented. Work session item 2.1 is information and discussion on health insurance. Dr. Shepard.
Thank you. So over the last several weeks, we have been working with our health insurance consultant to try to get our health insurance rates at a rate that would be affordable to us. Earlier this year, we were told that our health insurance rates would raise anywhere between 30 and 40% based on our claims, the amount of health insurance that we've used. So we went out for request for proposal, and we received several proposals. We have been negotiating with one of the people who submitted a proposal and think we have a plan. The intent is to keep our health insurance rates the same as they are this year, and the proposed increase is around 15.2%. So whenever we get to the budget part of the meeting, you will notice that at our last meeting, the increase for the locality was about 3.2, and we're down to 1.3 million at this point. No, the ask for the locality was
It's 2.3 million and the ask to locality is 1.3.
the last presentation. I'm sorry, I'll look for it real quick. But so at 15.2%, it would mean that we would remain with our current healthcare provider, which is Anthem Blue Cross Blue Shield, and the increase would be 15.2%, in which the school division would assume all of the responsibility for the increase, and the employees' rates would remain the same. So if you look at the slide that I have in front of you, it shows that the employee-only healthcare coverage with the dental and then the comprehensive dental, the healthcare insurance, $250 with the preventive dental and then the comprehensive dental, and the high deductible plan with the preventive dental and comprehensive dental. And that all remains the same from last year to this year with no changes. And one of the reasons that is important is our healthcare insurance was unaffordable 5 years ago. We've got it to a point where it is more affordable for our employees. And remember, we're still the largest employer here in Shenandoah County with over 1,000 employees. But if you look at the employee-only rate, you will notice that the proposed rate is $55. And for Frederick and Rockingham, I have their last year, their current year's numbers because they don't have their future healthcare proposals out yet. But for employee only and employee plus spouse, those two that are circled, we are lower than the other two divisions. For employee plus child, employee plus children, and employee plus family, we're a little higher, but we're within the ballpark. So we can compete with Frederick and Rockingham on those two. We do not want health insurance to be a reason that an employee leaves. And we've heard pretty loudly and clearly that our employees prefer the Blue Cross Blue Shield. We did switch to a different company a few years ago, and we received a lot of negative feedback on that. So we would like to propose that we stay with our current company. And then the next slide you will just see the health insurance cost over the last 4 years, and this year is the proposed year. So you will see 4 years ago, the employee plus children and the employee plus family plan was $913. So 5 years ago, that cost was $1,249 for employee plus children. And you will see we've almost decreased that by half. And this current school year and next year for the proposal, it's to be at $655. But again, the employee only is $55. The employee plus child is $278, and the employee plus spouse is $328. So again, just another way to look at the same information. You'll notice the preventive dental, and then the 1,000 plan with the preventive dental, and then right below that is the comprehensive dental, and it'll show you where we've been over the last number of years. Following that is the 250 plan, which is a little more expensive, but it has a lower deductible. And I have this information on this sheet of paper, if you will pass that around that way. And if you will pass that around that way, so it's probably easier for you to read. And then the last one is the high deductible plan with Shenandoah County Public Schools paying $125 per month towards a health savings account. And you will see those costs as well. So my recommendation at the March 12th meeting is going to be that we stick with Blue Cross Blue Shield, Anthem Blue Cross Blue Shield, and that we keep the premium costs the same for our employees.
Floor is open for questions.
So Melody, Dr. Shepherd, I appreciate the goal of keeping healthcare affordable for our employees because it's important for retention and even recruitment. But given the size of this increase, can you help us as a board understand like the multi-year sustainability of absorbing 100% of the projected increase, particularly if claims continue to increase?
Right. So one of the things that, while it's not been set in stone, one of the things that we're negotiating is to keep the increase for next year with Anthem Blue Cross Blue Shield, to keep the premium next year within a certain range. And that's one of our negotiation points. And while I don't know what the outcome is going to be, but they have said at one point that they would keep it at less than 14%. Okay. So while that's expensive, you know, we've made it a point to keep our health insurance rate. And how is that going to be sustainable? At some point, the health insurance rates may need to increase, or we'll actually have to start looking at different plans. Maybe our deductible is a little higher. Maybe we don't have the 250 plan any longer. We move that to a 500, you know, Anthem Blue Cross Blue Shield 500 plan. Maybe we make a emergency visit a little more expensive, or maybe we look at prescription drugs and make them a little more expensive. But you know, at this point, with us trying to keep employees, I think this is the right move to make.
Thank you. And
we do have 75% of our staff on our health insurance.
Mr. Rickard.
Haven't we been told in the past the reason this keeps going up with the insurance company is due to the number of claims every year?
Yeah. So while I'm going to agree with that, I want to make sure that our employees know that it's okay to use their health insurance because that's what it's there for. You know, if you have health insurance, you definitely want to be able to go to the doctor if you're sick or you're not feeling well or you want to have those preventative care. But yes, the reason our health insurance is so expensive is because we have a lot of high claims. And those high claims are either chronic illnesses or diseases, or our prescription drugs are fairly high. So, you know, it's a combination of multiple things, but our claims are expensive.
Is there a way we could work with Blue Cross to maybe raise the copays a little bit to curb running to the doctor every time you got a sniffle or whatever?
Yep. So our current copay on the 1,000 plan is $40. Is that right, Ms. Hodges? Yeah, it's $40. So one of the things that Blue Cross Blue Shield did say is that if we would increase from the Key Care 500 to the Key Care 250 to the Key Care 500, that would save some money, but not a significant amount of money.
Do you know how much that money was?
Yes, it was $200,000. The other piece to this is I compared our health insurance plans with the county health insurance plans, and our premiums are very similar. The county health insurance plan is their go-to plan is the 500 plan, and while our 250 plan are a little higher and our 1,000 plan is a little lower, they're comparable with the county's health insurance rates.
How much would those copays go up in order to save that $200,000?
So it would move from a Key Care 250 to a Key Care 500, which the deductible would move from 250 to 500. And currently our employees are paying more for the 250 because the deductible is lower.
But that's a deductible. What is like a prescription copay? Because that doesn't usually follow those exact same numbers. I mean, it's not $250 every time you pick up a prescription. So, I mean, and if a lot of our claims are prescription-based, it would make sense to look into that. I see where, your thought process is with that, Mike, and,
Yeah, I mean, whereas Linda said that doctor's visit is $40 each doctor's visit.
Right.
What could we save if we raise that to $50 a doctor's visit?
Now, knowing insurance plans somewhat, I don't think you can just raise a copay. You have to go from the 250 to the 500. So, but, I mean, other places have eliminated lower deductible rates, and then opened up like health clinics and things for people to go in, so it's not all going through insurance, and that was mentioned at our meeting the other day. So somewhere in the middle here would be good, because it's going to be hard to absorb this all the time and us do it solely. So, or even if we split the difference.
So currently, a specialist on the 250 plan, a specialist copay is $35, and like urgent care copay is $35 as well. So that's Key Care 250. Key Care 1000, it's $40 copay for specialist or urgent care.
Okay, well, I expected that to be a lot different. I mean, that's
It's not.
$5.
It's not.
But, and then, so I mean, maybe we consider that moving up to the other plans, if it would save, And excuse me, everybody, I'm not used to $200,000 being like a little bit of money. So,
Yeah, I mean,
if we save $200,000, that's $200 we could use somewhere else.
When I hear that number, 200,000, I'm thinking of teachers.
Yeah.
That's a salary. That's couple salaries, couple more positions we could fill.
What's the number of employees that we have on our 250 plan?
Give me 3 minutes. There you go.
Yeah.
I know I have that information, it's just not at the tip of my fingers. Our 250 plan surprises me at because it's more expensive, at how many people actually opt into the 250 plan versus the 1,000 plan, even though it costs them a little more money.
Approximately 190.
190.
So less than 10% of our staff.
200 of our 750. It's not
Yeah.
quite a third.
I thought we employed over 1,000.
We do, but only 750 take our health insurance.
Okay.
Yes.
Well, and there's also that point of view, so there's 25% of our staff who doesn't take the benefits, which doesn't cost us or the county anything. And then, you know, we're talking about the people who do, basically giving them what amounts to a tax-free raise by covering more of their costs. So, you know, I'm not sure what the right answer is there, but that's something to consider.
And some of our feedback that we've had in the past, when we haven't done anything with health insurance, is that we're getting a 3% raise or a 2% raise or whatever, but that's all going towards health insurance. So we want to make sure that it's not negative, that our employees aren't going into the negative.
Right.
If we do a raise.
Well, is there a way to incorporate us covering more of their benefits into their raise? You know, and that way the people who aren't doing this would still get more of the 2%, you know. Could we work that into the cost of living increase somehow?
I'm not sure I understand what you're saying.
So if we were talking about a 2% raise across the board, but if let's say we're covering more of your health insurance, so that would drop whatever the amount is that we're covering in your health insurance. That way it's an equal raise for all employees. You know, and
So you give them the option of, if they want to get it from the health insurance, then that kind of lowers their
yeah,
other.
yes. I mean, you know, so I just don't want to, you know, create any sort of, you know, hierarchy, you know, and you know, we want to keep teachers. I don't, you know, want anyone saying, well, gosh, you know, you got more of a raise than I did this year, you know, and I did more work than you or whatever. So, you know, I'm just spitballing there that, you know, because, you know, this will, and if it continues to increase and we continue to cover their, you know, the full amount of the rise, I mean, these people are getting significantly more of an upgrade each year than somebody who isn't getting the insurance.
And I guess it's kind of related to that. My question was going to be, because just to be sure that I still understand. So last year we were paying more to kind of lower those costs. So now if the insurance are going to go up 14%, then it's that amount of money plus 14%. Is that correct?
So last year's increase,
So last year we gave, in the budget, I think I remember correctly, we did actually put some money towards lowering that cost, correct? So then, I'm assuming we're gonna have to do it again this year, because those costs are still there, so we're still gonna have to do that, except that now the cost may be going up another 14% from Anthem. So then we're talking about, we're paying that money that we originally paid plus another 14%.
over the last 5 years, our health insurance has not decreased. So we have put more money towards health insurance every year over the last 5 years. And I think if you talk to any organization in the Commonwealth, they're going to say their health insurance hasn't decreased over the last 5 years. So health insurance just continues to rise, and you know, it really is based on our utilization of the health insurance. Currently, we pay, and it's an extreme number. We pay $10.5 million for health insurance. And we're only paying Blue Cross Blue Shield $11 million. So they have to pay people to do our claims and things like that. So they're losing money on Shenandoah County Public Schools.
I understand that. I was just trying to figure out what the number is, because again, we're not just talking about 14%. We're talking about 14% plus what we're already paying. So then, so it's whatever that number was last year plus a 14%. I don't know what that number is. Maybe Kaylin has it. But what are we talking about exactly in terms of? the big number.
Well, yeah, so what you're asking is what are we putting out now as a division plus the 1.3 in additional that we're going to have to pay in? I think that's what you're
It's last
asking,
year
right? Yeah.
plus the 14% that we're gonna be,
Yeah.
assuming it's 14.
Right, so I think I just said it, it's, you know, our premiums are $11 million.
11 million, so then they're thinking about raising it 14% from that.
So
Yeah.
this would be, where's it?
1 point,
Our increase for next year is currently proposed at 2.3, almost 2.4 million, to absorb that 15.2% increase to the rates and keep our employee contribution the same as it is this year. That also has some assumptions built into it, assuming that perhaps new employees who come on might participate a little bit more, so we might get a little bit higher than that 75% participation, and we might get a slight shift in the mix, like more people might choose the 1,000 plan or the high deductible plan over 250. That's a lot of assumptions that come out to the $2.3, $2.4 million proposed increase.
So that would be what what the school board is paying, and the rest is what the employees are paying.
Yes.
Right.
So, if I'm hearing you correctly, how many employees do we have participating with the insurance in general?
About 750
750. So we're paying $11 million to insure 750 people?
in the current year.
Holy cow.
And how much is the money for raises that we're gonna be paying this year?
2.8 million, is that what you're talking about, total?
Oh, okay, yeah, exactly, 2.8 million.
2.869.
Okay.
So that's over $14,000. Over $14,500 for our employees that have insurance.
Insurance is not cheap.
I'm just thinking about the
Yeah.
employees that aren't on our insurance. That's really shortchanging them when it comes to salaries. I mean, that's huge.
Now, that 2.8 million in, for raises, how much is the state paying for that? Or is that,
That's not been decided yet. The governor's proposed budget included a 2%, but the General Assembly is still doing their reviews.
okay, so it would be 2% of the 3% that the state, and then we would pay for the 1%? If it happened like that.
They pay their portion of the SOQ positions.
What does that mean?
Would you like me to answer that?
Yeah, you want to take a stab?
So, the state has a vision of what a minimum school looks like. They might say, and I'm making up numbers here, that it takes 100 people to staff a school. We might staff that at 120 because we decide that we need an athletic director. That's not an SOQ position. We might decide we need extra ESL, EL teachers, even though the SOQ says we only need a certain number. So the state only gives us 60% of that 2% raise for the people they say we need.
60%, okay.
And SOQs are bare bones. I mean, we don't know of a division anywhere in the nation that would really staff at Virginia SOQs.
You could run a school with that.
You
It's a
couldn't.
40% unfunded mandate.
Pretty close. I would probably guesstimate that of the 3% raise, the state would consume just under 1%.
Really?
Anything else on insurance?
So I think what I hear is you want me to come back with a proposal. What would the cost be if we eliminated the Key Care 250 and made it 500?
I think at least having that information would benefit us greatly.
Yes, yeah, and if we can encourage more participation in the healthcare savings accounts, that could mitigate the issue with the higher deductible. Because, you know, if you have money in that account and you don't touch it and it's there, it's a lot easier to meet $1,000 deductible than looking at the app on your phone and going, geez, I'll have to wait till next week to go to the doctor. So, I mean, if we could encourage some of that, that may be a way to help us mitigate, you know, some of the costs.
Do we have that data already? How many of our employees are participating in health savings?
Of the 750, approximately 118 are on our high deductible plan, and therefore we offer the health savings account. Whether or not they participate, I don't have that in front of me.
So we don't offer the HSA unless they're on the high deductible. Could we offer the HSA for the 500
We
plan?
could, but it would cost more.
Okay.
Yeah, $125 per month for the number of,
Gotcha.
times the number of employees that would be on that plan.
Okay. Now you're saying $125 for us.
That's what we contribute per month. There would also be any administrative fees or anything else with setting those HSAs up and managing them.
What about the employee putting in pre-tax dollars to the HSA?
We already offer that.
So do we have the numbers on how many participate in that?
I don't.
Because I'm assuming that HSA is open to all employees, is that correct?
No, we only offer the employer-sponsored HSA to the high deductible.
Where we're putting in money. Can they not put in their own tax deferred
They
money?
would have to open a private HSA.
The flexible spending account for medical expenses is the employee contribution plan. If they have the high deductible health plan, then they do the HSA, and they can contribute additional dollars.
Gotcha, thank you.
But at the 500 level, could we put in less money? Like, does it have to be 125? I mean, what if we put in 75? That adds up too, right? I mean, just asking if that's an option.
Do the 1,000.
$130.
So that would be $387,000 if we did $75 per month per 430 employees.
Okay.
So that costs us more
Okay.
than,
Than what we would pay in the
Yes.
other thing. Okay. Thank you for the quick math over there, everyone, by the way.
Any other questions? Would you like to see anything else on health insurance at the March 12th meeting? Besides moving from the 250 to a 500?
Is there any chance that we can negotiate them down any further? No? Okay.
Unless we changed deductibles or pharmacy,
Okay.
yeah.
All right.
Well, I guess that's it. Discussion of the superintendent's proposed fiscal year 2027 budget and capital improvement plan. Madam Superintendent,
Thank you.
we anxiously await.
Thank you, Derek. So I won't go through these in their entirety. I will point to a couple of slides that are different, but here is the timeline over the next couple of months. Our next meeting is Thursday, March the 12th, and that's when the school board will approve fiscal year 27 budget. And then on Monday, March the 16th at 1 p.m., the school board and the board of supervisors meet to talk about the education budget. And then shortly following that, the board of supervisors will establish the tax rate for the advertisement, budget advertisement, and then the public hearing for the board of supervisors proposed budget and tax rate is April the 6th at 7. So we always look at our budget goals, and our 3 division goals that have budget priorities attached to them are academic achievement and growth, recruitment, support, and retention of professionals, and high quality and adequate facilities and learning environments. So nothing on this page changed, or on this slide changed from the last meeting. We are still requesting 3 special ed teachers, 1 special ed program compliance teacher at the northern campus to serve both Signal Knob and Strasburg High School, and then 2 full-time special ed teachers, 1 at Ashby Lee and 1 at W.W. Robinson Elementary School. Right below that, you'll see grant absorption. So we had all in Virginia funds for the last few years, and from those all in Virginia funds, we would like to continue to employ 3 full-time special ed teachers, an assistant principal at Ashby Lee Elementary School, an interventionist at W.W. Robinson Elementary School, and then tutoring and attendance recovery program. And the last meeting, Mr. Rickard asked if we had any supportive documents on whether the tutoring and attendance recovery programs have been successful, and I sent you guys, I sent the school board information on the attendance recovery. We are still gathering information on the tutoring and the success of that program, so we should have that for you soon. But in the halftime aviation instructor was grant funded through a personal donation, so we would like to include all of those things in the budget at $737,000. And then we also have, I have proposed 3 additional sports program: middle school volleyball, 7th grade boys basketball, and 7th grade girls basketball. We currently have 6 sports programs at the middle school, which includes 8th grade boys and girls basketball, boys and girls cross country, and boys and girls track. So those are the athletic programs currently at the middle school. We used to have more athletic programs at the middle school. Someone talked earlier about the recession back in 2008, 9, 10, something around that time, and those programs were cut at that time in order to save money.
Are our middle schools doing something different across the county? Because at our middle school, you can participate in middle school basketball, boys and girls, in 6th grade and 7th grade.
That's if you make the team. So for example, we had a middle school that had 65 students, boys, go out for boys basketball, and they only have 1 team. So they have, it's considered an 8th grade team, but they have 1 team. And sometimes the 8th graders play up to JV. But when you have 65 students go out for a team that you can only keep 15 players, that means that 45 players are not on the team. And I know our coaches want to keep as many as possible because, being cut from the team, or either not making the team or not being able to play really discourages a kid from continuing that activity.
So you're proposing, at our end of the county, it would be 2 basketball teams, boys and girls, at the middle school?
Mm-hmm. So there would be a 7th grade team, which 6th graders could play, and there would be an 8th grade team, which maybe some 7th graders would play up, but there would be 2 teams.
Okay.
Yeah.
Thank you.
Mm-hmm. And each of those are about $20,000 a piece. So for the the middle school girls volleyball team, about 20,000 for 7th grade boys basketball, and that includes officials, uniforms, travel,
Coaches.
coaches. And then recruit and support enthusiastic professionals. The proposal is a 3.25 cost of living, and that is 2.869 million. And then also provide a $5,000 stipend to individual teachers who serve as special ed teachers, so whether they're either newly hired or currently in that role. And this would be one of those one of those stipends that would likely stick around for a long time. So if we fund it this year, we would need to continue to fund it. We know that the most vacancies that we have are special ed teachers. The hardest to fill are our special ed teachers. And then health insurance increase. This is the number that changed, and I have my old slide here. So this went from 3.2 million to 2.3 million. So that decreased from the February 12th meeting. So from 3.2, so about $900,000 to 2.3 based on our negotiations with the health insurance. And this slide is the same as it was previously. And then the last two items were the additional funds for our increased electricity bills and some additional maintenance funds. And then capital improvement plan management and oversight fund. This would be for a person who would oversee the our CIP, our capital improvement projects.
Would that end up being a permanent position or a temporary one?
So it could be temporary, but we know if we're gonna embark on some major capital projects, it would be sort of long-term, because if we're doing major capital projects for 5 to 7 years, whether we renovate, expand, or build new, we're gonna need somebody to manage those projects. And in the long run, it could save us more than $155,000 a year. But it could be one of those positions that are on a yearly contract.
Thank you.
Yeah. And that number, $155,000, is salary and benefits, including VRS and health insurance, so on and so forth.
But whereas, what buildings were the windows overlooked? Sandy Hook, and there was another one on those renovations to the lobbies. How much did that cost us in change orders to go back and put those in?
I'm not sure what the cost in change orders, but yes, it was overlooked.
Whereas if we had somebody overseeing those projects, be less likely to get overlooked.
Yeah. And change orders cost more money.
Uh-huh.
Because the contractor adds their markup and the architect adds their markup, and so change orders do cost more money. And they can look through the plans and see if there are some cost savings measures before they actually get started. I worked on a project where the construction contractor actually identified the type of block was a premium block, so they changed the block to a less premium block. The scope was the same, the block did the same as what it was supposed to, but it saved $250,000. So that could be something that a construction person could do.
Well, and, no disrespect to Kevin, but I think he has enough to do without handling building new schools, renovating other words, and all that would be an insurmountable task. So I think this is a great idea to have, but it should have a sunset clause. I mean,
What?
sunset clause. I mean, when we're done with the capital improvements to this level, that the position would go away. If not, my other suggestion would be that we, subcontract and 1099 with somebody to do a construction management firm. But that may end up being more money later, but it would cost less in benefits if we did it that way.
Of course, if we do that position on a yearly contract,
Yeah.
then we don't need the sunset clause, right?
So then, the potential request from the county is $1.3 million. Now, this number still has some opportunity to go down. The General Assembly just did crossover this past weekend, and the crossover, I think I have it right, the Senate proposed a 3% increase, and the House proposed a 2% increase, and there were some other things in there that could decrease this number $200,000 or $300,000. So we will not know. Hopefully we'll know before March the 12th, kind of the direction which they're headed, but I don't know that we'll know before then. But this number, this $1.3 million, was actually 2.15 at our February 12th meeting. So it has decreased because the health insurance decreased. And if we decide to go with, if the school board decides to go with the Key Care 500 versus the Key Care 250, that may also decrease this number as well. Okay, so I'm going to stop here and give the school board an opportunity to actually talk about what you just heard before we move into the capital improvement plan, because I think that's a separate discussion, and we want to have this discussion first before we move into the next discussion.
I appreciate all the information you shared. I'd just like to delve a little deeper into the insurance aspect of it. I'm just not a big proponent on eating all that cost. If the inflation is due to how much it's being utilized rather than, people being a little more cautious of when they're going to run out to the doctor, maybe they would do a little bit better job of watching their health.
So I think the number of claims that we have over 50,000 is extreme. And that's not people running to the doctor, for a sniffle or the flu or whatever. That's people who have serious health conditions. And we had, I don't remember the exact number, but we had quite a few claims. I think it was $2.3 million that were over 50,000 when you combine them all together, that were over 50,000. So those are not claims that are necessarily going to go away.
I also look at that number, almost $15,000 per employee on health insurance compared to the people that don't partake in our health insurance. That's quite a huge number.
Yeah, and I'd like to figure out a way to, just spread that love out a little bit, because, that's I didn't do that math. Thanks for doing that, Mike. That's a lot of money. So, I'm not saying that we turn around and give everyone $15,000 additionally, but, I'm concerned, we're creating, different tiers of compensation here, as a collateral damage or whatever, unintentionally, because, we're talking about $5,000 stipends for certain employees. Does that apply to parapros? There are SPED kids in gen ed classes quite a bit. They're not always in just a SPED classroom, so, if I'm a teacher and I don't take health insurance and I don't work in the SPED department, I'm a gen ed teacher, well, I'm kind of being left behind. Everyone else right now is getting something more, and I know everyone doesn't teach for the money, but I worry about creating just unintentional consequences that that could create competition or dissension amongst our ranks. And add that into buildings that are falling apart. There's a lot of things here. So.
And while I understand that logic. Any employee of Shenandoah County Public Schools has the opportunity to participate in health insurance. So, you know, while I completely understand the logic, because I have had employees reach out and say, well, I don't take health insurance, I would like to have some of that compensation. I get that too, but any employee has the opportunity to take health insurance. And things change. We had an employee whose spouse lost their job, so they needed to get on our health insurance. So they were able to, because of change in something status.
Yep, and one thing too that I learned at the committee meeting the other day, you know, where I went to the insurance and benefits committee, was that a lot of our employees, like the ability for us to switch to another carrier, you know, whomever, United or whatever, is limited because a lot of people would have to change doctors. So, you know, if we switch to United, my guess is people would have to decide, well, I stay with Dr. Smith or I don't take the insurance, you know. So none of this is a direct, easy line to figure out.
Yep, currently Anthem serves 99.5% of our doctors, whereas other health insurance only did 90%. So people are choosing.
Yeah. So
would either have to change doctors or pay for those visits. Are there any other things on the previous slide that you would like to speak about other than health insurance?
I have a quick question. I can understand that our special education staff, they're the toughest to recruit, but can you help me understand what are the 80 positions that are potentially, that was in our budget book to receive the 5,000 stipend?
It would be our teachers who are working specifically with, who have a caseload, manage IEPs and manage students with disabilities.
And then when would they receive the stipend?
So it would be every month in their paycheck, which would then go towards their VRS retirement. And we did a little research on this, and we have many of the school divisions that surround us are currently already offering this $5,000 stipend, and those who are not are planning on offering something, whether it's a $5,000 stipend or something.
And that would be like an onboarding stipend. You wouldn't have to be with us for, you know, a certain amount of time before that stipend kicked in.
That's right.
I think it might help the rest of the board. Mike went to the SEAC meeting today, but there was a SEAC meeting last year, I think, or the first year I was on school board. And when you get to hear from the staff that are SPED teachers, and you start breaking down a gen ed teacher that only has to prepare one lesson plan to a SPED teacher that has to plan out 27 individual lesson plans, that's when you start to notice the difference. And to get that presentation, maybe Ms. Journell could speak to that and help the rest of the board understand the workload on the SPED teacher as compared to a regular gen ed classroom teacher.
And how many SPED teachers are we short right now?
6 or 8. I think it's 6.
And that adds to what you just said, because they have to do more because their caseload is bigger.
Yes, that's correct, because our long-term substitutes cannot do IEPs.
Right.
And keep in mind, we have teachers in the gen ed classroom that have SPED certification but have gotten away from SPED because of the workload, more than likely.
All right.
Is there anything else on any of these other slides that you wanted to chat about? Okay, so we will move to capital improvement. This is the same information that Mr. Hensley and Ms. Campbell have been presenting over the last month to us, maybe. This slide may have changed slightly. I just added the numbers to the graph, to the chart, so that you guys would have them in front of you. The requested versus the funded, but otherwise it was included in all of the other. We will not talk about the major capital at this time because we will talk about that next. So we will save that one for a few minutes down the road. But you can look, you know, here was a chart that just said, you know, the estimated cost of our desirable, necessary, and urgent. And I think what Mr. Hensley has said a couple of times is some things are in the desirable category because the way that they're scored, they don't necessarily ever make it to urgent. However, they are still urgent, you know, urgent projects because they've been on the desirable, because it doesn't take a lot of time to plan for these projects, or maybe it doesn't have a direct impact on student learning. So they may stay on desirable forever. This sheet right here actually breaks it down with transportation, safety and security, HVAC, and what those costs are per year over the next 5 years. And if you subtract out the major capital items, that's right at $20 million. And the $8 million that we'll talk about in a little bit is for the design. And I want to be clear on its design. It's actually architectural drawings, which CAD plans, so that a construction contractor actually can look at those plans and say, this is what we need to do to either renovate or expand or to build new. It's not another study. I hear a lot of people saying, are we paying for another study? It is not another study. It's actual design drawings.
And then, question, at that point, that's when we can start trying to get some of the grants that we have been talking about, that we have been missing on. Okay.
Yes. And both the General Assembly and the Senate, I don't know where my page is, have put in some additional funds for construction projects.
Okay.
Yeah, in their crossing budgets.
Would that be for the next year, or what's the deadline of
It
that?
would be for the next fiscal year, yes.
127 million.
How much?
127 million.
127 million, yeah.
Okay.
So again, we're going to skip this right now because we'll be talking about our major capital here in a minute. But here's our transportation request, and you can see, you know, this is the total cost from fiscal year 27 to 31. Our safety and our security. Nothing has changed in any of these slides over the last 2 months. So I'm going to kind of scan through them really quickly. If you need me to stop, please tell me to do so. Anything that is in red, if we do another project, if we do an expansion, if we do a renovation, if we do a new build, these may be removed because we don't want to waste money. We want to make sure that we are, with those renovations or those expansions or the new build, that we're being good stewards of our funds. And then there's our budget timeline. For the purpose of this discussion, I'm going to scroll back to here. And if you have this sheet from probably the last meeting, this is probably the best thing to look at to actually get a good idea, or if you want to discuss any of the specific projects or whatever, this is a good visual for you. And if anybody needs one, I have one here in my hand.
I can't find mine. Thank you.
This is all covered in this book though as
It is,
well, right?
it is, yes, but it's, yeah. That's kind of a, yes, it is. So be happy to try to answer any questions. And I have the experts here with me, Kevin Farmer, Chad Hensley, Kaylin Campbell. They were the ones who did the site visits along with the principals to identify these projects for the CIP list.
Has the numbers for the HVAC moved anymore? Like, where are we at with the?
We actually meet with Train tomorrow,
Okay,
so we'll get another update tomorrow. They're waiting on subcontractors as far as electrical.
That's correct.
So I have a question on the transportation, because I know that was a question last year too, and Tom's not here and to ask questions. It says the 5 school bus purchase, but it says necessary. So is that something that we're actually doing? I mean, is that included in it? And is that because they need to be replaced, even though they still have mileage in them, or is it because we're adding routes, or what exactly is that for?
So this is just for replacement, and I think we moved from a 15-year replacement at Tom's request to more of a 20-year replacement. But there were a couple of years, and I'm gonna let Chad correct me if I'm wrong, but there were a couple of years where we purchased 10 buses and 9 buses, and because we had CARES funds or whatever, we have to put those into the equation, because it's gonna be very difficult for us to replace 10 buses at one time, because that would be a couple of, several $1 million. So this is just for bus replacement on a 20-year cycle.
So we're replacing 5 this year?
5 buses, and that's the average number of buses that we need to replace every year on that 20-year cycle. Is that right?
Yes.
Okay.
We're trying to get into a cycle so that we're not purchasing a large amount of buses at one time. Because what you said before, we had funds, so we purchased large amounts. So there will come a time that those buses will reach their mileage in their time too. So we're trying to look at all of our fleet and very strategically pick the buses that we're replacing to make sure it works out. We have 94 routes that we run.
will any of the possible new building and stuff, will that add more routes?
So,
Or will we be able to reroute everything? I don't,
yeah, I think we'll be able to reroute. It just, maybe if, it just depends on, what the decision is. But maybe another school starts at, maybe one of our schools start at 8 and the next school starts at 8:15. And one ends at 3 and one ends at 3:15, something, there can be some adjustments in that manner, but that may increase bus driver pay. But we'll just have to see what the decisions are.
right, okay.
Any other questions, thoughts, changes? Great. Think you have one more, Derek? Major capital? And this is identical to the last two, I believe, that the last two meetings. It has not changed, so I will scroll through a lot of this really quickly. I do want to stop on the approved housing. Strasburg, we have 320 homes, which would be about 145 students. Woodstock, there are 873, which would be almost 400 students. In Edinburgh, it's 30 with approximately 14 students. And remember, these students would be between grades K through 12, so they wouldn't all land in one school. They would be likely spread throughout. So So I am going to skip, because you've seen all of this, I'm going to skip through all of this fairly quickly. But I do want to get to the page that has the information right here, the summary for the potential elementary school project. So on the left-hand side, you will see new elementary and renovation of existing elementary schools. And you'll see the cost of the new elementary school. Preliminary is about 45 million, and then you'll see the renovated costs. You know, these are all preliminary projected numbers, estimates. I can't say that enough, estimates. And you'll see what those costs are there. And then at the bottom, you'll see those numbers combined. So the total preliminary budgeted estimated cost for new elementary school and renovation of existing elementary school is about 70 million, but you can see where the range is, which is right above that. And then the expansion renovations of elementary schools, you'll see where Sandy Hook, W.W. Robinson, Ashby Lee. This would add the 10 classrooms to Sandy Hook and the 10 classrooms of W.W. and it was fewer than 10 at Ashby Lee. I think it was 6. And that cost is about $48 million. So I think if the board would like to talk about this first, and then we will go to the CTE projects and we can talk about that.
Does this include any of the existing renovations, HVAC and things that are already on the CIP for the elementary schools?
So if we were to do the expansion and the renovation of the elementary schools, or even the renovation of the elementary schools, those projected costs include those items in those costs. The HVAC, the roofs, the painting, so on and so forth.
Right. So I've emailed the school board and you guys a little bit of a hybrid model of both of these, which also includes some work to triplet tech and expansion in a couple different ways. I've managed a lot of construction projects, not to this size, but there's one thing that keeps coming out to me with building a new elementary school. If we started today and decided, let's vote, if we voted on that tonight, there's a chance that this still might have to go through a referendum in the county. And the planning stage, VDOT approval, all those things, I don't believe that there is a kid in kindergarten at Sandy Hook or Robinson right now that would set foot in that new school before it was time for them to go to middle school. I know how construction takes. Look at our vestibules, we had problems. So my suggestion is we do the renovations at the schools and the new building at the same time. Go big or go home. And I've heard some of our Board of Supervisors say we can do more things at once. So I've developed the basis of a plan that will help address all the needs in the most efficient amount of time. So funding, of course, is not in our hands, but if we renovate and start renovating those existing schools right away and start the design process on the new elementary school, we're not wasting any time. Because I think about, and Miss Weineking's here all the time, and she's, really gung-ho with this. I feel that if we prioritize building a new elementary school and we wait till the end to renovate, those kids, we're looking at 7 to 10 years of kids that are still going to be in the same conditions that we're complaining about today. So, but how do we alleviate overcrowding? We have to move kids out of the building. So is it feasible to wait until we finish building a new elementary school? I tend to disagree with that because we need to move them out now. Because if we start building a new elementary school, we're going to outpace the construction in Strasburg and Woodstock. I doubt it because they've already started. And there's a lot more hurdles in building a school than there is a house or a townhouse. So my plan, and I'll ask for it to be put on the agenda for us to go into deeper at the March 12th meeting, or if it's not enough time, the one after that. But my proposal is to do that, to begin design and work on the new elementary school, to begin renovations immediately by moving kids out, which would enable us to work in blocks within the schools. Because I do not see any way for us to be able to not work when there's kids in the school. And if we can isolate 5, 10 classroom blocks, move 5 or 10 classrooms worth of kids out, and my first attack or plan there would be to move the pre-K kids, maybe the kindergarten kids to off-site, or we bring in modular units to keep them on each campus. But that would give us room to start to work. Because my calculations, even at a very quick pace with people in the building, it's going to take us 3 years minimum to do all this renovations inside the classrooms that should have been done 20 years ago. So if we wait another 10 years, I feel that there's kids that are going to kind of feel left behind. And then I also look at the other aspect with the staff. How do we decide which staff gets to leave the dilapidated buildings that are sick buildings and goes to a brand new one? We're going to create a lot of a logjam. Eventually that will happen, but the main push for my idea here is it can address everything, including CTE, at the same time. We do have some options and some possible things in CTE, which Dr. Shepard's going to get through here soon, but we could move some of the kids out of CTE, possibly up here to Woodstock, to some existing buildings, which would give us some room to start renovating inside. It would create block space inside Triplet as well. And a lot of our plans, and I look at being, certainly connected directly with Ashby Lee. I look at the gym problem there, and we're building brick and mortar and block buildings. For gym and and all that. And I've been to the gym up at Sandy Hook, the one that isn't connected. It's a metal building, but it's the nicest gym space we have, minus the fact it doesn't have plumbing. It's the most modern. So I think if we looked into, on the list is to expand a gym, at least at Ashby Lee, well, we could use a steel building there. And we could also use a very large steel warehouse type building at Triplet Tech to give us the room that our dirties need there. And then we could move them out into that building, which would be permanent. And we could then create lab and classroom space in the, that's needed inside that building. So, it needs work, but this is, I think, a plan going forward. And our Board of Supervisors has asked for a long time for us to bring them a plan. So my intent here wasn't, to do away with any of the other plans, but I've got some detail here, steps, and it would be a 5 to 7 year process, with the longest part being building the new elementary school, because that's going to take longer than any of the other parts here. And then it would give us time as well at the end, depending on how much it costs, to explore traffic changes at Woodstock and maybe a future CTE building there. So, hopefully that was the time to bring all this up, but here we are. So, and I think it's something that hopefully we can work ahead. We have a infrastructure committee meeting next Monday. With the Board of Supervisors. So, maybe we can start to hammer out together a little bit more of a plan other than build this or build that. Because I can't prioritize in my own mind anything on this list. To me, they're all of equal need, which is renovating our existing schools because we can't close them. CTE is a shining star in this county, and that has to be addressed too, but I think simultaneously, we have to look at building the new elementary school at the same time. I just don't see how we can wait till the end. And I've talked about this with different staff, because another thing, and this is the one that will make me unpopular with some people, if I'm not already, is that we may have to move fifth graders out of the buildings, at least temporarily, back into the middle schools to create room to do these renovations. So, but these are all ideas and, the formulation of a plan, but in my mind, it can address everything on our list, and I think it'll be cheaper than adding on to, the cost of adding on and expanding the schools, because I don't know if that's a forever option. Eventually, one more thing. So right now, luckily, the building and expansion is limited to the towns. Our county has zoning rules that you really can't build I think it's 5 acres to build a house, somewhere around there, or you have to ask for it to be rezoned. So if that ever changes, you will see what's happening in Woodstock spill everywhere. So we do have a buffer, and there's a few board of supervisors here, so please keep that buffer for a while, because we need it. Because we can't keep up with the new construction unless we plan ahead. And I think that the plan I've come up with we're looking farther ahead than we have been. Back to you.
Let's go back to something you said about a referendum. What is the tripwire for that? Is it the money?
It depends on how it's financed. So, so when I asked Mr. Vass, and he explained it to me, but, it's still as clear as mud to me, but there is a chance, depending on how it's financed or how it's paid for, that a referendum might be required. So, and that also jumped out at me that say we should really look at the renovations, because what if it went to a referendum and we were deciding to spend money on plans and it doesn't pass? We're right back to where we are now. So
that referendum would apply to the renovation money as well, right?
It depends, it could, yeah, it could.
So I mean,
but
we're talking about the money total.
yes. But that could, we could ask for it to be divided up to, I'm sure, in a referendum. I haven't thought that far ahead, but.
Well, and I think that's, because that was one of the things that I was going to ask about. So I do have several questions, because I think all along the idea has been that we would, or at least for some of us, that we would be starting with the new elementary. At the same time, we would start renovating some of the stuff that we can with the elementary schools. The city at Triplet, well, I personally favor the idea of moving it to the central campus, starting with a smaller blueprint there for just like a few of the classrooms and the business, but at least that way we have the architectural plans that would go forward. So, it could be several stages. Maybe the first stage is moving a few of the business ones, then the other ones can stay where Triplet is, and a few years later, when we have the money, then we expand over to the next wave and do it by stages. So I don't think CTE is going to be a problem. I don't think they're going to be displaced. Ultimately, the question is for elementary schools, what would happen? And I know we've explored this and talked about this over the last year, that if we built the new elementary, then obviously that's going to relieve the pressure from the northern and the central campus, and eventually the southern campus potentially. The question has always been, well, what do we do about the renovations? Because those are going to have to be done one way or another. And by the way, one of the reasons why I want to get started on the new elementary school, something that we've talked about, is, like Dr. Shepard said, once we have those blueprints, then we can start asking the state for help to help us with some of those funds. We've been missing out over the last year because we've done nothing on this. So again, question is about the current elementaries. you know, what do we do with that? Because we really can't have that construction at the same time that we have the kids in there. So that's where I kind of, I guess, more clarification on what this is about. Because we had talked about the idea of having the additional classrooms or the, you know, the trailers, or even moving to another off-site, like what you said here. But Dr. Shepherd had, and some of the other people had clarified that even if we do that, that site has to be made, you know, renovated, or have all the permits and have it ready for those kids. We can't just pick a building and say, okay, yeah, we're gonna put those classes in there. That's gonna take some time. In addition to the time, it's gonna take money. You know, it's gonna be the money to get the building or the modulars or whatever, and then the money to renovate those. So I guess the question regarding that would be, do we have an estimate of how much that would cost? Because if we're scrambling to get money here to just even renovate our schools, are we gonna have money to renovate, you know, build a new school, renovate a school, and renovate the buildings where those students are gonna be in the meantime? Or the modulars? I mean, even right now, to get the ones that we just got for Sandy Hook was hard, and we still don't have them ready. You know, and that was, you know, like Ms. Boynton said, that we're supposed to be there in October, and here we are, they're still not ready. So, you know, there's a lot of this stuff that we had talked about in the past that come up, and even those modulars. How much are we paying for each one of them?
For the quad unit, for total install in the first year's lease is going to be approximately $400,000, and then I believe it's a little over $90,000 a year after that for lease.
So and that's just for how many? For 4 classrooms. So we're talking the millions already then, once you're talking about the 2 schools. So again, it's the idea of that, you know, that cost, and then the time it is going to take some time. So, you know, obviously it's not an easy answer. And like you said, and like other people have said, this is the result of years of neglect, of years of the board of, you know, of this board just kicking the can down the road and not doing anything about it. And then things, you know, obviously as they age, they get worse quicker, like it happens to us. But in the end, yes, I'm you know, I'm personally for the new. We need to move on the new elementary and get the plans and all that. We do need to start doing the renovations. I thought that the architects had looked at a way that we could stagger those renovations so that they would interfere the least amount with our students. I thought we had heard that at some point, that they had a plan that they said, well, we can fix this during the summer, or we can fix this one year, or we can fix this once the kids are moved over, but I wasn't sure. Did we hear that or not? I thought we did.
That's what I thought.
I was under the impression that the architects had already done that. So, so in any case, those were my comments, because again, I think we really need to move on that new elementary, and I really don't want to kick it down the road anymore. And then the renovations, I would like to get them better clarification from the architect, if we had that plan, the staggered plan already, or if this is what we need to do instead, you know, come up with our own plan. Because again, I was under the understanding that the architect was doing that.
So that was something Dr. Heingartner talked to RRMM about. So I don't know that it was a plan that was written down, but it was a conversation that was had. Absolutely. Right. Yes.
So this is something that maybe we could ask the architect, as they're drawing the plans for this, what are the suggestions on how we can do this with the minimal amount of, you know, interference for our school day?
Yeah. Well, and, you know, and the plan that I'm coming up with as a starting point does not include adding all those classrooms. So I just want to be clear there. You know, it doesn't. It's not really expanding other than in a few spots, addressing the cafeteria problems, which is, you know, mostly flow. We don't have enough, you know, lines to get kids in and out efficiently. So that would help in those aspects. But I don't see how we can renovate those schools without, you know, I mean, it can't be done in the summer. That's impossible. And if we have, you know, we have roofs, we have HVAC. If we have a wet summer, you're behind schedule, and, you know, and it's going to impact the schools to a point. I mean, the vestibules did. So, I mean, but if we get kids out of the building, my thought is that we can affect less at one time.
Right.
So-
But, and that's what I think we've been
Yeah.
trying to do this over the last
Yeah.
couple of years. It's been, let's do the roof first, and then let's do the HVAC, and then let's pull the carpet. And then, we've been doing it piecemeal by now because that's the only way that we can not interfere with the students. The problem is if we do try to tackle them on at the same time, then like I said, then we're running into the additional cost of getting another site, of preparing that other site, or getting the modulars, or, and where do we put the modulars? Because then it wouldn't be just one or two, it would probably be a lot more than that if we're gonna be doing a whole, half of the school or half of the other school. So, again, if we were to consider that, then we would have to add that into the budget.
Oh, no,
That's gonna be a significant-
agreed, and that isn't something, I mean, I didn't line item and budget the whole thing. This is just something for us to discuss, to try to see.
By the way, I
if we-
appreciate you doing this.
No problem,
And
yeah.
I know that I appreciate doing this work. I was just, it's just one of the things that, again, I thought I was under the impression that the architect had talked about doing this already for us. Because I would like to, hear their input on this. As to what, since they are the ones who will be doing the actual work, what suggestions do they give in terms of doing this with a minimal amount of interference with our.
Well, and this would be something that they would coordinate with our new, the person who would be in charge of this, so, which is another reason I think that position that we decided to add is great, because that could expedite this and, and handle a lot of things, because we'll need, if we're gonna work in 5 places at once, we're gonna need either 5 different contractors or, one big, huge company that is gonna be able to handle all those things at once. So, but, no, I hear that, and, the idea of bringing in modulars, if we put, we got 3 of them or whatever on a site for 3 years and put the pre-K and K kids in there until we did the renovations, and then they would go back. Those would be temporary, but we don't, and there aren't a whole lot of, I mean, I wish the county still owned all the old elementary school buildings that they got rid of, because maybe we could open those for periods of time. But
We've talked about that. I know we've talked about some of the buildings, and that's part of the problem is that we.
No, yeah,
Right, I mean,
we're
correct.
limited.
You can jump in, because I know that we've had this conversation.
Yeah.
And in talking about it with Dr. Shepherd, there was just nothing. I mean, there was just nothing we could do. And if we obtain a new building, then obviously it's going to be the cost of the new building and the renovations, So we've really explored a lot of that, and it just seems like our hands are tied in many ways. And I'll be honest, I think I'm not gonna assume anything, but this could be part of the reason why this has been kicked down the road. It's a lot easier to just say, you know what, this is too hard, I'm just not gonna do it. So, it's gonna be a challenge, but I think there are ways that we can definitely.
No, but, for me personally, it'd be hard to prioritize anything over starting to address the problems in the buildings that we have right now. Like, I don't wanna have to choose either or, but that's why, I think hopefully we can come up with a united way to say we need to do all of this when we ask the Board of Supervisors, because to me, waiting until we complete an elementary school is going to push it too far down the road.
Well, no, and I think that's why we're
Yeah.
adding it in there. That's why I think
Yeah.
it's new elementary plus renovations.
Yep.
'Cause we are, that was the whole point, was to actually do both of them at the same time.
Right.
I feel like we're getting too deep in the weeds. All the supervisors want to know is what we need. I appreciate all the work you did, and I love it. However, one teacher already reached out to us today about moving 8th graders and 5th graders and all that, and the impact that has on the kids. But I feel like we're getting too deep in the weeds here, and but I agree, we need to build a new elementary school, and simultaneously we need to renovate. I'm 100% on board with you. How are we going to renovate with the kids in the building? There's experts out there that can figure all that out. When I saw your plan, I saw dollar signs, and then I hear the teachers that came to talk tonight, and there was another lady that came to talk. Her and her husband have been in this ever since the beginning. Karen Rozak, she's like, make a decision and just stick with it and do something. We've been talking about this and beating this horse for over a year now. And the Board of Supervisors just wants to know, hey, tell us what you need and let us figure out how we're gonna finance it. And then we go to the professionals and say, how can we do all this?
Well,
and
I
get it
think
done?
that's one of the major points here is that the Board of Supervisors have been asking for something in writing. And, you know, right now, it's here in black and white, kind of extended from the previous option A, B, and C, you know, providing like a workable starting point, which quite frankly hasn't been available before. You know, this isn't perfect and we're not expecting to do it like step by step, but again, it's a starting point to what the Board of Supervisors has clearly asked us for. And I can commend you, Mr. Scheibe, for putting all this together.
Thank you.
I greatly appreciate it.
So, but, you know, but I've viewed what the Board of Supervisors has asked for differently. Because, I mean, I've spoken to them individually, and they've asked for a plan, not just, you know, a broader view. So, I mean, but we'll talk about that on Monday. You know, so, you know, and that was a main push for this. So, because I don't know if they're all on the same page with what they're expecting from us. Because it seems like when they've asked, you know, we brought things, or, you know, we want option C, they said, but we want to, you know, we want more. So what's the more they've been asking for? Because they've been asking for it.
The
So-
more takes money to hire professionals and say, this is what you need to do. I mean, for what you
Got it.
did.
Yeah.
What's it gonna cost us to get modular units at all the elementary schools? What's it gonna cost us to lease space wherever it's
Sure.
available, to get the permits, all that stuff? Because that tax on money on top of the budget already.
No, understood. And that we have to figure out, but, you know.
But
So,
is there-
but the alternative is, you know, we hold off on all that, you know, I don't, you know, that's
See,
where.
my thing is we're talking this thing and planning it to death, whereas there may be an architects and planning firm that can say, hey, based on this, we could do this, this, and this over a summer, and then we could move this over here. You know what I mean?
Mm-hmm.
Well, if I can add something, I think part of the problem that we've had in the past is that, you know, the options that the board was considering for the last year or so was, do you want a new elementary? Do you want to renovate? Or do you want the new triplet? So
Yeah,
it's
I
one
know.
of the things that we were like deciding between those three, which ones are your priorities? Whereas now we've kind of come up with the idea, well, you know what we really need is this, you know, say for me is the new elementary school and, you know, renovating the schools. But if we can get started on the CTE and the triplet, which would not only start the ball rolling, but would also take advantage of some of the other opportunities that we're getting from the donors, then, you know, that would be a better plan. So to me, this is the plan. The plan is, you know, this is the new elementary, the renovations, and if we can get started with a smaller, you know, school for the triplet and have the plans to grow it, that would be ideal. But then in the past, we've had this problem where it was picked between the three, and then we would pick this, and then somebody would say, well, how about if you move triplet to the Freedom, you know, the Free Press, or what if you keep it a triplet and then renovate it? So there were just so many options out there that I think the problem was everybody was talking and everybody was having a different idea, that it got confused, I think. And in the end, I think what we needed to do was say, okay, this is what we really need. We listen to the community. We see what's coming down the pike. We really think this is a priority, you know, our elementary school. So if we can do this and we can do that, and then we can also do this, then that would be a great plan. So I believe that that's what they were looking for, as opposed to something more, you know, detailed like this. I could be wrong. I have not.
You know,
so.
and, yeah, and I absolutely understand that, but, you know, up until, you know, now, or, you know, or if it happened in the past, it was in very small, you know, it wasn't broadly spoken about. We're not addressing the overcrowding that we have right now. And we have to address that right now. So that's the only reason I came up, you know, with this thing. I mean, none of this is going to cost, I mean, it's all going to cost money, and lots of it. You know, so, you know, we'll have to figure out what's going to be financed and what isn't. But like I said in the beginning, they're all you know, I think they're all pretty much equal priorities. And the other thing too is, I mean, you know, I've been reading studies and different things. We want to get those test scores and stuff up. I mean, you know, the most immediate and cost-effective way to help our two elementary schools that are having trouble is going to be fix those buildings. That dollar is going to go farther than the new elementary school right now, because what happens to the kids who don't go to that new elementary school? They're still in the same thing. So, I mean, the overcrowding will end, but, you know, I think we need to address the overcrowding now, not, you know, down the road. And that's the only reason I really push this and put all those steps in there. So, and like, you know, and I'll let the rest of you have a meeting here soon, but, you know, this is just, you know, an idea to try to work from, because, you know, the us versus them that we have here that I'm looking at, you know, we want a new school, we want this. I mean, I want to find out a way to give them all what they want, you know, and not have my taxes go through the roof, but, I mean, you know, I'll raise my hand with what Mike asked too. I mean, there's no way around that, no matter what we do. So, but if we spend more money now and plan it out further, it will cost Shenandoah County less money 40 years from now.
I find myself largely in agreement with the board members on my left.
I've never
That a
been
new
called
element-
a board member on the left.
Oh, you are
I
the only
have
one.
never been called one.
On the ideas that were expressed.
That's funny.
The new elementary school deserves to be prioritized. You can build that school in 3 years.
I respectfully disagree with that.
I respectfully submit that the second largest office building in the world is the Pentagon, and it was built in 16 months and 16 days, and it has over 4 million square feet, and we're only asking for 81,000 square feet. It can be done. That's what, 750 workdays in 3 years. And I do not agree with this business of moving the 5th and 8th graders to another school. It is highly chaotic and disruptive and unfair to the kids and the family. And you're not just moving the kids, you're also moving the teachers and their belongings, and how many manpower hours will be consumed aligning, moving teachers and their possessions and so forth, and then moving them back. And I know you use the term swing space, you're creating space to do the renovations, I understand that. But do you really want to do the renovations while there's a student population in the school for the reasons cited by the lady with the shovel? With the noise and the chaos and...
Tell me how you do it without doing that. Explain to me how.
Summers and breaks.
So that I think would extend it out to probably a 12-year thing. I mean, it took us 6 months to build vestibules.
That all depends. I mean, being in the construction world, I can tell you there's projects out there that run 24/7 to get them done. It just depends.
But at a much higher cost.
Sure, it's going to increase the cost. How quick do you want to get it done?
And, you know, and on the Pentagon thing, how long did they take to plan it? You know, I'm sure that stretched it out, you know, a lot longer, but no, but, you know, I agree. I mean, you know, and these are all points, you know, that I'm bringing in. I understand that. I'm just, you know, I'd like to know how we can do it quickly and efficiently without waiting for that elementary school to be done.
Well, because I think what's happening here is we're gonna be prioritizing, right? Like the things that we can do now before we have that new elementary school. So for example, the HVAC system has been something that has been a real big problem for us. I mean, we keep hearing from parents and about the mold and all that kind of stuff. We're gonna have to deal with that.
Yeah.
It's not gonna be able to wait for the new elementary, it's not gonna be able to even wait for the quads. I mean, this is something we're gonna have to be doing now, and we have been doing it. We have been taking care of that as we go along. The same thing with the roof of some of our schools. So I think that those are, you know, the ones that are real priorities we're gonna have to be, you know, dealing with right away. The sticky point is gonna be when we're talking about the cafeteria and all that kind of stuff. That's gonna be a little bit harder. I don't know if that can, you know, be done over a summer.
That could be.
So, but again, those are things that's the way we've been kind of doing it anyways, and we're gonna have to do it. It's just a pity that we can't, you know, do all the renovations in the next 6 months because we have students, so it's obviously gonna have to be stretched out. But it is the way that we have been doing it in the last, well, at least since I've been here. It's at least, you know, targeting the stuff that is more urgent.
Right.
And that's the one thing that we don't need the supervisors to do. We don't need even us. I mean, I don't know if we need to vote on that or not, but I believe that the administration will be able to, you know, prioritize which are the things that need to be changed right away, next summer, you know, all that kind of stuff. You know, I would have to think that the people who are doing the HVAC are not the same people who are doing the roof, so they could both be working at the same time during the summer. So I mean, I don't know, but that's just something that what Mike was saying is kind of getting a little more into the weeds. That I don't think we need to do that. I think that's something that can be solved as we are going along. Whether we vote on this or not, we're gonna have to do it.
Right.
Like whether we vote on this or get a new elementary, those things in the current elementary schools are gonna have to be fixed. You know, whether it's the HVAC or the plumbing or the electrical or whatever, that's gonna have to be done.
Right.
Regardless.
Yeah.
One thing we definitely want to avoid, sorry to interrupt, is putting something in and then changing it during construction. So we want to make sure that we spend our money wisely, whatever that is. So we don't want to put in an HVAC system and then 3 years down the road, replace it.
Which
We
would
wanna
happen
make
if we
sure-
were expanding.
Right, we want to make sure that it's relevant and that it's going to stay. Whatever we do, we want to make sure that it's going to stay.
But that's something that you can do, that can be done, so, yeah.
I happened to be in the building in 2003 when Strasburg High School was renovated. And I think the summer break was 3 months instead of 2, but, you know, maybe it was 2.5. And you left there in June, and you came back in late August, and where'd all this come from in such a short amount of time? New gym, renovation of classrooms, office space, classrooms. It was remarkable what they got done in those 75, 80 days of break time. And as you said, there are some folks who will do it 24/7 when the little kids are not there breathing the vapors that were spoken about. And the other thing, this is just perspective. You look at the development that's going on in Woodstock, and it's on the south end, extending to the west, the Eagle property, enormous. Whatever elementary kids there will be, the 0.5 that we sometimes take, and I know they won't all be at the elementary level, I understand that. Well, naturally, they're going to go to Robinson. And you look at Strasburg, and the housing out there is on the north end. Well, whatever elementary kids will go to school will go to Strasburg. And it just makes sense to have that new building somewhere between the attendance zones of Woodstock and Strasburg to reassign those students to the middle, between the attendance zones of Woodstock and Strasburg, to make room for those housing development kids. I'm not sure I'm labeling that right, but to make room for the kids that will be coming in on the north end of Strasburg and the south end of Woodstock. So it needs to be there and attack the overcrowding. 97% at Sandy Hook. Holy cow. Holy cow. That's just not safe. It's just not sane to have that many kids in that little space. So, from a geographic perspective, there's a need for that school to be in somewhere between the jurisdictions of Woodstock and Strasburg and soon.
Can we address also the concern with the park? The park would still be there, right? This is just additional area in that Morristown, because I know that there was a concern from a citizen, that would not affect the current park that we have in Morristown. It would be areas that are not being developed right now.
So while this is still a conversation we have to have with the county administrator and the board of supervisors, there's hundreds of acres, I don't know, a couple hundred of acres there. I don't know how much of it's buildable, I don't know how much of it's allowed for this type of project, but, and if we didn't do it there, would there be another spot that it could go? But yes, that was just used as an example. And we've had those preliminary conversations with the county administrator, but nothing in great detail.
And look at the infrastructure that is on that site. That this has to be tweaked, as the architect said, but he sealed the deal for me when I mean, his face lit up when he pointed to that potential drawing. I didn't hear the cash register ring when his face lit up, but it's a beautiful site. And you have Morristown, Thomas Brook Sewer and Water. You have the you have a road which he acknowledged would have to be fitted to the school. You have some recreational areas already in place, and
right on Route 11.
it is.
And to go back to that metaphor Larry hit on about the Pentagon, I mean, we're all assuming how long it's going to take to build this thing. A general contractor may be able to come in and go, you know what, I'll have this thing done in a year and a half or 2 years. Whereas we're all assuming it could take 3 to 4 to 5 until we talk to general contractors and architects. We're guessing at things. Whereas I really don't think we need to know all that at this point. We're just the school board. All we need to know is what's it going to cost? What's it going to take to get it done?
Hey, Mike, Empire State Building, 1 year, 45 days, and built during the Great Depression.
Holy crap.
Yeah.
By hand.
I did not know that.
And consider all the square feet that takes up.
Right.
And we're only asking for 81,000. Am I not right on that, 81,000?
That's what we had on the long-term facility plan. I think the architect proposed something different. Maybe.
Is it 90?
Well, let's shoot for the moon. Let's make it 100,000.
We'll go ahead and put a county pool in there. We'll put an auditorium.
Yeah.
That's what I would like to see, yeah.
Go big.
And I gotta say, I know we haven't even hit on the triplet tech thing yet, but that bottom line needs to be centrally located, and we have the land there at Central Campus. To me, I mean, we're missing out if we don't get something started there. I liked your plan. I hadn't even thought of it, of building it in phases. Start with something small, just get it going.
So with that segue, I'll just forward to, you've seen all of these slides before, but right here is the breakdown of the CTE. We've got the renovation and expansion of Triplet Tech where it's currently at $38.6 million. Remember that these three different scenarios, the renovation expansion of Triplet Tech had a $1.5 million for equipment. The renovation of Mount Jackson Press Building and renovation of Triplet Tech had a $2.5 million what's the word I want to use, for new equipment. And then the new CTE and renovation of Triplet Tech had a $5 million. So while all three of those, if you take that number out of there, they are all within about the same cost. So if you take that new equipment number out of there, because I think your new equipment number is going to be the same regardless of which facility that you have, because the equipment that's capable of being moved will be moved, and the equipment that's not capable of being relocated will stay where it's at. So, so I think regardless, the new equipment cost should not be in those numbers at this point. But then that makes them really close to the same number.
And that's not taking into consideration that the new facility in the central actually gets the donor.
That's correct.
So that actually makes it even lower.
Yeah, so the project on the right, if we did the project on the right, we do have a person who has obligated $5 million for this project, and that's the new CTE facility in the center of the campus. And they actually indicated that they would help with the actual building of that facility. And it didn't have to be a 90,000 square foot. It could be a beginning of a CTE center.
Which Gloria had come up with the idea, I don't know if you guys were on school board yet, and that was have the plans drawn up for a 90,000 square foot building. But just to get things off the ground and rolling right now, because that person would like to see something coming to fruition, do it in phases. You know, if we can't afford to do it all right now, the new CTE building, 30,000 square feet of it, with the ability to expand later on, but have the drawings drawn up for the whole project.
Right.
Yeah, so it would take longer, that for sure, but it's fine because we're probably not gonna have all the funds right away. But the idea was, once we have all the blueprints, we can also seek funding from grants and all that stuff too. And it would also help with the donor that has, very generously offered to donate to our triplet, to our CTE program. So the idea was, we start out with a smaller building that could have some of the business classes, like cyber or maybe cosmetology or whatever, that do not require the high bays, that do not require any special, areas to conduct the classes. So we start with that. We continue to have all the other ones still back at triplet. And then eventually, the next stage is after that's done, then we go on to the next stage and then start building the high bays or the, I don't know if the culinary would be at the beginning or at the end. I'm not sure. We had kind of talked about it, but that's the idea. It's that at least you already have the plans, you've already paid for the blueprints, you already know how everything's going to go. So in addition to all that, this also helps because part of the budget that we have in here has to do with the egress from that central campus. So it would actually add more ways to get in and out of the central campus, which right now is a huge bottleneck also. It's a nightmare. So it would actually open up another way to get into the campus, which would also help all the other schools in there. So, so that was kind of the idea of doing the stages for the new CTE, if we did it at the central. And again, and I know we've talked about this before. I know there's a emotional attachment to triplet in the southern part of the district, and I understand that. But if we are to be fair, right now there's a lot of kids in the northern campus that are not able to really take advantage of that because it's very far. So in that sense, I think it would be more fair to have it in the center where we can have more students coming also from the northern part. And the triplet building, I mean, it's still going to be used. I mean, we can actually still use that. We've talked about that. That's something that we can use for other facilities for our district. But at least this way, when it comes to the CTE, we're making it available to all our students.
Well, in this plan, is that a simultaneous thing? Like we're gonna start to plan and build in Woodstock, but still renovate the existing triplet?
guess it depends on the funding we get from the county.
Yeah, well, you know, and back to my plan, I mean, this is in that too, you know, and kind of going back to that, you know, my plan is, or, you know, or proposal is to try to hit all of this at once if we can afford it. You know, we need shop space now, so I mean, you know, I think the renovation at the existing triplet would, you know, and simultaneously with planning for something new would make a lot of sense. And, you know, but I also think that we could use a steel structure there to create shop space that won't require nearly the type of money it will to build it in concrete or block. And that CTE Center in Culpeper, they built the entire thing out of, you know, a steel building. They have warehouses, they put shops in them, you know, farm buildings. So that is a less expensive option for renovations that maybe, you know, would be more immediate. It also takes a lot less time to put that in, you know, and that money could be spun back into something else, you know, so, but.
My only concern with putting a steel building on that site is that's additional cost when what I believe we're trying to do is move the whole CTE, the whole triplet tech to the central campus. So now we've constructed another building at the triplet campus. What do we use it for then?
Storage. We don't have a single storage building in the entire district. I mean, you know, so, but you just said it, I mean, yourselves, we're going to start small and move up later. I mean, you know, when is later? I mean, none of us will be on the board anymore. So, I mean, that would solve their immediate needs, which are there. I mean, you know, Mr. Judy's here, you know, how in order to move a car in and out, I mean, he's like shuffling cards. You know, you should work in Vegas with how you guys move those cards around. So, I mean, you know, once again, though, that's, you know, back to my original point, these are all pretty urgent needs that we need to, you know, we need to push through fast.
But what you're saying is have those in that triple tech renovation budget. That's what you're saying.
Yeah, and erase building a big shop space and supplement, you know, and switch it out with bringing in something that's more or less prefab would go up faster, and it would get them in it a lot quicker.
Okay, so it would be replacing some of those costs.
Yes, yep,
Yeah.
with lower ones.
So it may lower.
So, you know, and yeah, from my calculations, could be anywhere from a third, you know, it could be a third to 30 to 40% cheaper, or and sometimes much more than that, than building it in, you know, with concrete and steel.
I think it's worth exploring. I mean,
Yeah.
I don't know.
Do we need to touch on the health sciences move here?
So, not at this time, there's no definitive, but I will just give a little bit of information. There's been a lot of conversations with Shenandoah Memorial Hospital about moving our healthcare sciences classes to Shenandoah Memorial Hospital. This is actually something that started probably 2 years ago, and Todd Lynn was very integral in helping with, you know, those conversations as well. But it was moving all of our healthcare sciences, even our biomedical sciences classes, to an infused facility at Shenandoah Memorial Hospital that they're interested in renovating to make classroom space for Shenandoah County Public Schools. So while they're still raising that money, they've got part of it donated.
But they would absorb the renovation costs
Yes, yes.
and you know, and I believe there was asbestos in there.
Yes.
So, you know, that would be another ready-made, you know, and quick way to, you know, temporarily or permanently
Relocate.
move, to
That's right.
relocate.
Would there be any long-term lease costs on that? Would
So
we have
we-
to lease that space?
Right, not at this time, we've not, you know, gotten into that level of detail, but at this time, they wanna give, so we benefit because our kids actually go to school in a place that is, likely their future workplace. So, so we benefit and our kids get the opportunity to go to the emergency room or, get to be able to do things that they wouldn't be able to do at Triplet Tech. And the hospital benefits by seeing our students in their facility and hiring them as soon as they're ready to be hired. So it's a pretty win-win situation with both. I know there's been some hesitancy with our healthcare teachers about wanting to move away from Triplet Tech, but that's a consideration as well. But the relationship, the conversations has been ongoing. I just met with Shenandoah Memorial probably 2 to 3 weeks ago, and they're still all in and interested in doing that.
I know the last meeting we had at Triplet, there was a whole lot of talk amongst the teachers against it. Has that needle moved any, or have those conversations continued at all?
No, I think the teachers are still very concerned. The ones that would move to Shenandoah Memorial are still very concerned about moving because it separates them from their other colleagues. Who they've developed relationships with over the last, many years.
One good option or point though might be that the phlebotomy people would have some other people to practice on, because they practice on each other, and every time I go there, they ask if they can, do you want to go get stuck? So, at least they'd have some more there. But there's my positive spin.
It gets them closer to those job training opportunities, internships, all of that.
Major capital.
I think so.
Now let's move to cell phones
Okay.
and other AI equipment.
So I am, a school board member requested for us to revisit our cell phone policy, so I am going to turn it over to that Mr. Shouty.
Me again. All right. So, my the drive to adjust and make our cell phone policy or cell phone use, particularly by students during school policy, was just to make it a little more encompassing, to cover things, in particular AI glasses, beta glasses, and things like that. I made no attempts to change the original policy, especially in regards to staff use, because we did get an email concerned over, staff use, and a couple constituents had talked to me about it, and teachers were asking, does that mean I can't have my wearable device if I, use it for my kids or whatever? And people see me looking at my phone during the school board meetings. I have an 8-year-old who's a type 1 diabetic, and I count on this to see what his blood sugars are. So, but to me, that is covered under appropriate use. I don't see any reason to totally reinvent the wheel here in this policy, other than to make it a little more encompassing, because, if there will be kids that will come in, well, it's not on there. It doesn't say. So, this just gives us a little bit wider of a net, and specifically to address unsupervised technology use in our schools. So, and the proposed, the changes, that's all they do is they make it, they list more items that would be included in a cell phone or wearable. It doesn't really change the already passed policy.
Yeah, to me, I don't see an issue with it. I just look at our teachers and our staff. We're putting more on them about monitoring this stuff. I don't know. Now they got wearable rings, so.
Yeah, I was gonna say.
Yeah, so I was a little bit more loose on the cell phone free education back when we first did this. I said, let them have them during lunch.
Right.
That type of thing, but I don't know. It's just a whole big open can. I think I would lean to Dr. Shepherd and her staff. How have the schools been doing since we've adopted the cell phone free policy?
So what we've heard is that there is a lot more noise in the cafeterias during lunchtime because kids are actually talking to each other and not looking at their social media. So we've heard teachers sing praises because they don't have to worry about kids bringing them out during class. So I think it's worked well.
And,
you have
and
anything
there
else?
again, you brought up a good point about your own son. I've heard from other parents who have 504s and their kids are allowed to have their cell
Yep.
phones.
Yeah.
So, I mean, there again, the teacher's got to figure out, okay, Johnny's got this device, but does he have a 504 that allows him to have that device? You know what I mean?
Mm-hmm.
I just wish our teachers could just teach. I don't know.
Sure they do too.
Yeah, I guess,
But, you know,
I mean,
our
if,
schools are doing so much more than just teaching anymore.
like I said, if this stuff needs to change, I'm not against it.
Yeah.
It doesn't
I mean,
affect me one way or another.
This to me is would, kind of, and I was looking at it and, and I talked to some teachers in the southern campus and, this would make it a little easier on them because it's already defined. That's included versus, having to go through it later and all. So, and it also, I think, would help give them a little more of a heads up. Hey, I need to look at these. So, because until somebody sent it to me, I was like, what are you talking about? What the heck? Or, and I looked and I was like, wow. And then he sent me a video of him wearing it. And, and then I was like, what do they look like? And they look like the old, Henry Kissinger glasses. So, and from that era. So,
Why? Because after you talked about it, I think the next day I saw an ad. I think it was Oakley, maybe, that had.
yeah, in the Super Bowl, that was the only thing I remembered about that.
So I commend. I like it. I think this is not going to be the last time that this is going to be updated.
Agreed.
And I have heard of some students, using their, I have an Apple, what is it, Apple Watch, whatever it's called. I just use it to work out so I can listen to my music, and that's all I know about it. I know people can, talk, and they can get their phone calls, and they can send their emails, and they can do all this stuff. So I agree with this. I think it's fine. Like I said, it's not going to be the last time we update it. So I'm on forward. I mean, in favor of it.
Well, I'm also told that these watches, that parents can track where their children are. Which
I don't know what they do.
you don't have to be a helicopter parent to, but you want to keep an eye on where they are, and particularly when they're doing extracurricular things. Does this policy do away with the watches?
Well,
Yeah, that's what it is.
yeah, well, I mean, in classroom time, I mean, this policy, unless I'm wrong, is bell to bell. So extracurricular is really, that kind of steps away from that.
So if you're sitting in class and you're running cross-country and practice gets canceled because of the rain or whatever, but you can't have your cell phone to tell mom to pick you up at 3:30 instead of 5:30, and she has to make those adjustments in her schedule. Shouldn't there be a place for that?
That's why I fought for lunchtime getting the cell phones, was for that exact reason, the kids that play sports or do activities after school. But in light of what Larry's talking about, the kids can have the cell phones in their book bags.
Yeah.
So if my kid has his cell phone in his book bag and his book bag is with him, it can be on, and I know his location throughout the day. There again, there's watches out there that look like smart watches that aren't necessarily smart watches. So, I mean, this is where I'm like, you start down that road, you're...
Well, but we kind of already have.
Right.
Which is,
That's why
Gloria's saying it's just going to keep going. But, I think that, in my personal opinion, with what you're saying, though, I mean, even if it's not a watch, hey, coach canceled practice, I got to call my mom. What do they do now in the existing policy? I mean, you know, I would think that if they went and said, asked permission, they'd be allowed to use their phone.
Yep, so there's two things that they do.
Yeah.
One of the things is, yes, they can go use the phone in the office, but when this, the original cell phone policy came out, we asked the coaches to do something different than they were doing previously, not to communicate to the kids, but to communicate to the parents, and I think it's through the Remind app.
Oh, okay.
Remind or Sports U.
Yes, yes,
Yeah,
that's correct,
okay.
yes. So that's how the parents know that practice is canceled or delayed, or the game is canceled or delayed, or whatever.
And on the tracking thing, I just see it as an article of safety.
But like Mike said, like, the parent away will still track them. I mean, as long as that cell phone or whatever is near them, you know, or in their book bag, it will still do the same thing. I mean,
Okay.
But I mean, I'm kind of along the lines of Larry, but that's why I deferred to Dr. Shepherd and her staff. If we're not having a problem with watches and wearables now, like I said, I'm not against it, whatever you guys feel that we need to do, but if it's not an issue now, do we even need to worry about it?
no. I mean, you know.
Yeah, I mean, I think we had talked about it before in terms of the only reason why we were okay with the smart watches, whatever, is to like kids who had to monitor, you know, like seizures or, but that can be already.
Well, yeah, that's
killed
covered in a
because they-
504.
Yeah, exactly.
you know,
They'll
if
get a
you need that.
504, so those kids
So.
are still going to get that.
Yep.
And with regards to that, you know, as Dr. Shepherd said with the Remind app or whatever, when my kids were doing sports, we were getting that too. So we were getting the notifications if something was canceled, just like they were. So we knew all along. If anything, it's probably better because that way the kids cannot pull a fast one on you and, you know, say, oh no, I still have practice, and then go and do something else and get in trouble. So, so yeah, I don't really see that as a concern.
Where are we now? Oh, report of board members and other business. Mr. Rickard, you're up first.
Oh, well, thank you.
Oh, you're welcome.
Really don't have anything. Thank you all for the jobs you continue to do. Thank you for staying here and putting up with our stuff for these late nights. Thank all our staff and community members that showed up and taken interest in what goes on in the county. It is much appreciated. It's nice to know what the constituents are thinking, especially the constituents who are also staff members. Because of course, they have a higher stake in this than just the people that live here. They live and work here. So I really appreciate each and every one of y'all that take the time to show up and speak what you believe should be the priorities and take an interest in not only our students, but our buildings and our schools and the budget. Other than that, that's all I've got.
654, Mrs. Pence.
Like Mr. Rickard, I also want to thank the public for just coming out and giving us your opinion, letting us hear what's going on. You know, I value the community's engagement, and it really does provide an interaction that we can't get any other place, you know, if we're not coming in and seeing you or you're not writing to us. So I do commend every single person that has come here to speak with us. And as we talk about planning and investing for the future, I just want to recognize National FFA Week. I want to commend our FFA students and our advisors for the work that they do. And we can just remember that that agriculture is the #1 industry in Shenandoah County. And then Mr. Vance and I have begun briefly just visiting the campuses just to get in front of folks. And I just want to say how well we've been welcomed there, and I'm going to allow you to elaborate a little bit more on your comments as well. And then finally, I had the opportunity, I think it was Valentine's weekend, to attend Central High School's production of The Wizard of Oz, and it was phenomenal. If you didn't make it to that, you're really missing out, because it was really great to see the talent and dedication of our students and staff. So I just want to commend them on that, and I'm actually looking forward to seeing the rest of the productions that are going on in the county. And as usual, thanks to all the folks who are around this table, the folks who are the boots on the ground every day within our schools. We do really appreciate what you do for us. Thanks.
District 3.
I don't have a whole lot, but I don't want to sound like a broken record, but I want to thank everybody for being here today, because honestly, you guys are and should be the ones that help guide what we're going to be doing. And if we don't hear from you guys, things can get lost. So for all of you who came here, for sure, I thank you. But also for the people who weren't able to come here and sent us emails about this, I really appreciate that. I want to send my condolences to all our kids who did not get a snow day. Well, the rest of the Eastern Seaboard did get one. It was funny. I was looking at the forecast yesterday, and there was this little sliver that didn't get anything, and that was us. Sorry. And finally, after sitting there for 2 years, I really don't like this. I feel like I'm giving my back to the people, and I really do not like that. So I was gonna make a request that maybe we can put the board members in an L like that, so that I can at least face them, because I feel really rude. So I apologize for my rudeness. So that's all I have.
That's interesting, because when I had that chair, I felt the same way.
But you didn't speak up. Yeah, I don't like it.
District 2, absent. District 1, Mr. Schaub.
Well, I mean, seconding what Ms. Pence says, thank you. It's FFA recognition time, and that is just such an amazing program. So, and you never hear problems from it. So, I mean, that's another shining star. And on the CTE stuff, I want what everyone wants. I want a new school. I want triplet. And I want to fix the schools. So I'm just impatient. I want to do it all at the same time as quickly as possible. So I want to be clear there. I'm not arguing to renovate the schools instead of building a new elementary. I'd like to try to figure out a way to do both. And, we're at a unique spot here in Shenandoah County. We've got years of neglect. We've got reassessments. We've got taxes coming out of Richmond. So I feel like I'm on that Andrea Gale boat or whatever in The Perfect Storm with George Clooney, because this school board and the Board of Supervisors, we've got to make some decisions that have been put off for a long time. So I think we have to be frugal and disciplined in every dollar we spend, and and I still 200,000 is still not a little bit to me. That will help somewhere. And to our teachers, I hear, what you're saying. I know the conditions you're working in, and you're all doing an amazing job in poor conditions in a lot of cases. So, we're in it with you, at least I am, and that's my main concern is the teachers. You're in direct contact with our kids every day. And, and I can relate to what you're dealing with being a coach for so many years. So, we're all in this together. So a unified division is going to be what's best for all our kids. I'm going to pull one. So at the last meeting, I had a quote from Abraham Lincoln on his birthday that I forgot, but since it still is February, George Washington once said that knowledge is in every country the surest basis of public happiness. So, our schools are the most important thing to all of us and to our government and to our country overall. So thank you, everybody here, for listening to me ramble tonight, and but for being dedicated for what we're all here for, and that's for Shenandoah County kids. So thank you.
So it's my turn to ramble, is that what you're saying?
Yes, like I said.
Let me begin by thanking Mr. Hensley for some prompt action on some pruning, shaping, and removal of some trees at the Sandy Hook campus, and also to Kevin, the part you played in that. And I know, because I was over there the other day, when they leaf out, they're going to look so good in that tulip shape. And there's more to come, right, with the dead pin oaks on Ram Drive. And I'd also like to thank Mrs. Proctor and Ms. Heingardner for allowing me to go to Sandy Hook last Thursday and visit the targeted intervention. And I want to go back, and I want to see them matching those lesson plans to those objectives. And I was really impressed, and I've told some other people this, just one little minor thing, those little toolboxes that were in there, teaching kids to count the spots on the dice and so forth. I thought that was a nice manipulative. Okay. As chairperson, Vice Chairperson Pence said, we've had the opportunity to go to the campuses and to visit. We were in the northern campus last Wednesday. We were in the middle campus last Friday, and we will be in the southern campus tomorrow morning. And this tour that we're doing was actually scheduled for the week of the blizzard, so it had to be rescheduled. And it was just so good to sit down with some of those principals and see how the pieces fit together in their schools and see the different incentives they have for the students. Mr. Schlettner spoke at some length about the incentive programs he has for improved grades and attendance. And that Peter Muhlenberg, for example, the vice principal, if they make 97% this month, he's going to shave his head in front of an assembly. And they were very, very close. What was it, 96.5, wasn't it? 96.5, I guess if you did the rounding, but he's demanding 97%. So I can understand that. And the kids. Well, let's see. We started out in the life room at Strasburg High School. Well, they serve coffee at 8:15 too. That helps too, but the kids were glad to see us, and then we moved on to other parts of the building. At Sandy Hook, we saw a demonstration of yo-yos, and that was very cleverly done. And we walked about to the outside classrooms and around, and then we came back to the cafeteria. And you know what I'm talking about, and so do you, and get to witness the luggage that they carry. And oh my goodness, some of that luggage is really, really, really heavy. It just pulls on your heartstrings. So anyway, it's been a good tour, and we look forward to finishing it up tomorrow, 8:15 at Stonewall Jackson, I think is the kickoff for that. So it's all good all the time. Who would like to make the motion to adjourn?
Motion to adjourn.
Thank you, Mr. Rickard. Who would like to do the second? Right here, we got second. And we have a vote of yes to adjourn, indicate by saying aye. Aye. And opposed, no. And we stand adjourned until 12th of March at 5:30.